I'll be presenting today's Radiopedia.org case in radiology, Type 2 split cord malformation. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 10-year-old male who presents with sciatica and lower limb weakness. Taking a look at the MRI, we note that the conus medullaris terminates at the L5 level. It's likely attached to the posterior wall of the spinal canal. There's also a split cord at L1, L2, which is best seen here in the axial view. There's no discrete bony spur seen on the MRI images. We also have ankylosis of the spinal processes of L2 and L3, accompanied by an intervertebral disc thinning at this same level. There's cystic structures in the sacral canal from S2 to S4, abutting and scalloping the sacral vertebrae, most probably representing Tarlov cysts. Diastematomyelia, or split cord malformation, is a type of spinal dysraphism, or spina bifida occulta, when there's a longitudinal split in the spinal cord. Split cord malformations are a congenital abnormality and account for 5% of all congenital spinal defects. Type 1 is where there's a duplicated dural sac with a common midline spur, either osseous or fibrous, and usually the patients are symptomatic. With type 2, there's a single dural sac containing both hemichords. Impairment is less marked. Again, with type 2, there's a single dural sac and no spur or septum. The cord is divided, sometimes incompletely so. Hydromyelia may be present, and spina bifida may also be present, but other vertebral anomalies are far less common. Patients are less symptomatic or may even be asymptomatic.